Well, when it comes to the health of your heart, it's just not something you want to ignore. Today, we are looking at something called valvular heart disease. This is Dr. Mathew Sample. He's an interventional cardiologist with CVA, which is affiliated with Brookwood Medical Center. Dr. Sample, thank you for joining us here today.
Thanks for having me.
So what can you tell us about your procedure here?
Well, so valvular heart disease is very common.
Yeah.
After we approach 65 years, it's about 3% of the population will have some form of valvular heart disease. And
disease of the valves in the heart?
Absolutely. So it can either be the valve doesn't open as well as it should, or it leaks more than it should. And for the most part, these are mild to moderate conditions, but occasionally patients will become symptomatic and require therapy. That could either be through surgery, traditional open heart procedures that you and I think of, or with newer procedures, transcatheter heart valves, where we actually use a catheter to go through the vessels in the groin to repair or replace the failing valve.
What are the symptoms of this if you think you might be having some trouble?
Yeah, so valvular heart disease can range in severity from just mild fatigue, or I just don't have the same energy that I used to have.
But that comes with age too.
It can, and sometimes it's difficult to distinguish.
Sure.
All the way to very severe symptoms of severe shortness of breath with activity, even as severe as being admitted to the hospital with fluid overload. So
if you think you're, or you suspect maybe you're having some of these symptoms, what do? Do you go see a cardiologist?
Absolutely. So first off, talk to your primary care doctor about your symptoms, and if it's appropriate, absolutely, come see the cardiologist. We're always happy.
And can a simple x-ray, what do you use, dye?
So typically the way to diagnose valvular heart disease is with an echocardiogram, which are ultrasound pictures of the heart.
Okay.
This is a non-invasive test. There's no pain associated with it, and no radiation, and gives us a very accurate understanding of how the valves are functioning at that given time.
Okay. Well, you're brand new with being here in Birmingham. You've been here about a month.
That's right.
Born in Mississippi, so you're a Southern guy, but welcome to Birmingham.
Thanks.
Welcome to our show. Hope you'll come back.
Thank you.
Okay. Well.